Okay, what I wanted to show you was there's two sets of educational resources. The first set is for patients, technologists, and for radiation safety. And these are really the most critical websites, I think. The American College of Radiology, ACR, provides a lot of resources that will help you. Image Gently is really the website where you can find a lot of quick resources about radiation safety. Things you can use. They have PowerPoint slides where you can use to teach about radiation safety and information to give parents as well. Now, Image Wisely is really geared towards radiation safety in adults. So that is more the adult website that a lot of our adult radiologists have put together. This is really more for pediatric imaging. And radiologyinfo.org is also a wonderful place to go for additional information. These websites over here are really focused on teaching pediatric radiology. They have cases, they have diagrams. Radiologyeducation.com has a whole digital teaching file, okay, of probably thousands of cases there. And these are all free. The Cleveland Clinic modules was created by one of our current staff some years ago. And all of our trainees do these modules. There's wonderful modules on every disease in pediatric imaging there. I really encourage you to go look. You can sign up and log in. Again, it is a free resource. And they don't have to pay anything to sign up for Cleveland Clinic modules. No, it's free, right? I want to confirm. It's free. Okay, perfect. The American College of Radiology, and Dr. Sarantan described this yesterday. They have developed some appropriateness criteria, and these are evidence-based guidelines to assist referring physicians. It will help you determine the most appropriate imaging and treatment decisions in patients. And they have put scores for different types of imaging, okay? For example, in a child who presents with right lower quadrant pain and you want to assess for appendicitis, I'm giving an example. Ultrasound is the first test, and that's scored. Anything above a 7 is considered most appropriate. So it will get the highest score, 9. And they list what they recommend is the best imaging study and then some alternate studies as well, depending on what's available in your institution. The goal is to eventually provide the best care and the most efficacious use of radiology. So this is what the website looks like. You just go on there, and if you go under quality and safety, you'll see this, and then you can go in here and access the appropriateness criteria, and it will tell you what studies can be performed, and they even give you more details of what views to obtain. For example, the skeletal surveys here, and it will tell you what views you need to obtain, and you can implement that. They have practice guidelines for all modalities. There's a task force that put together the pediatric for both from an academic and private practice settings, and then here's also the direct link. You can copy and paste that into your URL. The imagegently.org is another website. Again, it's Alliance for Radiation Safety and Pediatric Imaging that's created this. There's a whole bunch of quick links here. There are links here for your technologists to go and read, as well as your referring physicians, pediatricians, and for you as well. And there's even letters and material you can use to, and you can probably take some of this material, translate it even, and use it in your practices, okay? Because it's all probably written in English. I don't know if we have translated this, but that's something I need to. Dr. Sarantan, the World Federation of Pediatric Imaging, do they have any material that's translated in different languages? Just in English, right? Okay. All right. But I think that's something you could do in your own practice. Just to tell you, it has a whole bunch of stuff. Here's educational resources for technologists, all about CT scans. These are all specific modules for different vendors. So if you have a GE CT scanner, you can go click on this, and you can get lots of information about that. If you have a Siemens, you can click on this, and it will talk about improving radiation safety in your department for CT imaging. And then there's lots of other different things here. They give you things about limiting patient exposure and tips and secrets of success of how to successfully do imaging in a very safe manner in your department. All right. So what about the radiology cases and teaching modules? Pediatriceducation.org is a wonderful. I happen to know this person here. This is a brother-sister, both radiologists who put together this many years ago, and it's been ongoing. And it's really an incredible resource, okay? It's all free. That's the important thing. All right, so you can go there. There are cases. You can download. You can read. If you are stuck, you're by yourself, and you have no one to ask, these are the things you can try to access, if you have it, to learn and say, oh, my case looks just like this, okay, and see how their approach is to the case. This is the Cleveland Clinic modules, okay, and this is actually the actual website, so you can copy and paste that into your URL. And what it has is we use this in over 290 radiology residency programs across the country. It has been used in 50 countries. There are 65 learning modules, okay? And it's all on pediatric radiology, and they're really outstanding, and they are created by people who really do pediatric imaging solely. And so, for example, there's a wonderful module on hip dysplasia. If you need to teach hip dysplasia, or you have to put together something for a presentation, or you yourself want to understand hip dysplasia better, there are wonderful diagrams and teach you about the basics of hip dysplasia, doing the ultrasound, interpreting the ultrasound, and of course, follow-up treatment changes as well on CT and MR. So everything is there in these. So I really recommend you can go in and register as a new user and go in and even check this out even while you're here, okay? All right, because we have Wi-Fi. All right, so it covers all the curriculum. The core concepts in pediatric radiology are all there. Okay, and then that's it.